Hi, my name is Natalie Yates, and this is my psychology and film assignment. The film I decided to analyze was Iron Man 3, the character Tony Stark, aka Iron Man. The film takes place in various U.S. cities in 2013, such as Miami, Malibu, and Tennessee. The events of this film take place after the invasion of New York in 2012 in the Avengers movie. Characteristics of Tony Stark include technology genius and creator of the Iron Man suit/armor, typically described as a self-centered classic narcissist. However, he does show character development throughout the films and becomes more selfless and caring towards others, which is portrayed in this movie especially. The diagnosis I would give Stark is anxiety and PTSD. Anxiety is described as persistent fear and anxiety that causes disturbances in behavior, and PTSD or post-traumatic stress disorder is described as severe anxiety symptoms after experiencing a traumatic event. Side note, while I would not diagnose Stark with OCD, he does show obsessive and impulsive tendencies and behavior. While Stark does not receive therapy or treatment in the film, his friends categorize his behavior as an anxiety disorder. Because anxiety is one of the most common psychological disorders in the world and is an issue prevalent in all cultures, I believe that it is diagnosed in all cultures. However, treatment plans do vary just based on access to healthcare or religious beliefs. Today, anxiety disorders are more commonly diagnosed and shared among the public, therefore the negative connotation surrounding these disorders has decreased. However, during the time when the movie takes place, some stigmas surrounding anxiety include being considered weak or displaying neurotic behavior. Some evidence for his anxiety is that Tony Stark experiences panic attacks and displays severe cautiousness in unnecessary situations. He does have a couple of panic attacks throughout the movie, which are followed by increased heart rate, shortness of breath, and unsteady movements. This happened when he was out to eat with a friend and also after talking to a child. He does take note of all weapons or threats in any situation, even those where there are no potential threat or imminent danger. This also happened when he was out to eat. However, he does not show symptoms of lack of concentration due to anxiety. For his PTSD, Stark experiences various flashbacks and avidly avoids situations or conversations involving past events. He endures flashbacks and nightmares after being reminded of the events that took place in the invasion of New York, and he gets annoyed with others when they mention New York and avoids stimuli that remind him of those events. However, he shows minimal instances of jumpiness or proneness to emotional outbursts. Side note, he shows obsessive tendencies such as losing sleep due to completely unnecessary tasks like working on creating more suits. However, this is mostly due to fear and anxiety, so I would not categorize or diagnose his behavior as an OCD disorder. For Stark's treatment plan, I would include medication and therapy. For medication, prescribe anti-anxiety agents in order to suppress severity of anxiety and PTSD symptoms. The side effect of drowsiness might also help him sleep. For therapy, I would suggest psychodynamic psychotherapy. Not only does Tony need to talk through the events that occurred in New York, but he also has some childhood/parental issues from his past that contribute to his self-centered mindset and behavior. Stark is a very wealthy individual and has resources for treatment available to him. However, as a well-known superhero, it might be considered weak to receive treatment for something as simple as an anxiety disorder. People might consider Stark to be less reliable if they find out he is suffering from anxiety and PTSD. However, Stark does acknowledge in the movie that he should probably be on medication and even confides in his friend Bruce Banner for an informal therapy session in the post-credit scene. Some ethical concerns regarding medication and therapy for anxiety include the basics, client safety, and refusal of treatment. Because Stark is considered a superhero, his safety is held in high regard. However, he's a very knowledgeable individual and has proven in past movies that he is able to analyze his physical condition personally and through the use of his technological inventions. For broader perspectives, I believe the anxiety disorder and PTSD are well portrayed in the movie. The symptoms were accurate, and the rapid onset of symptoms unexpectedly in different scenes of the movie show how unpredictable anxiety disorders can be. The movie depicts how debilitating anxiety can be and how they affect behavior, mood, and actions. While the reason behind Stark's anxiety aren't exactly relatable, the way his anxiety affects the way he lives his life can resonate with many viewers. On the other hand, psychological disorders portrayed in films are typically obvious and are usually caused by extremely negative experiences. This idea can skew viewers' mindset in the sense that they begin to believe that their own experiences are not severe or extreme enough to justify the way they feel. It is usually instances such as these that lead to a misunderstanding of these disorders, especially anxiety. Major traumatic experiences are not the only cause of psychological disorders like often displayed in film and can be experienced by anyone regardless of the personal circumstances.